This is the Pharmaverse podcast. I'm your host, Michael Pietrack, engaging leaders from the pharma universe. Hello and welcome to the Pharmaverse podcast. I'm your host, Michael Pietrack. And if you're a leader or an aspiring leader in the pharmaceutical industry, you're in the right place. You're just going to love today's guest, Rebecca Vermeulen. She's a 30-year veteran of the pharmaceutical industry, and she's now the Vice President of Global Patient Networks at Roche. She's led field teams, in-house teams, international teams. She's an incredible person and inspiring leader, and she's here to share her insights. Rebecca, welcome to the Pharmaverse.
Welcome. Thank you so much. It's great to be here, Michael. I really appreciate this invitation and just to share some perspective for whatever value it can bring for others.
Oh, it's going to be valuable, and I can't wait to hop in. And before we get really into your journey and what you've learned along the way, help us just understand what the remit is for a VP of Global Patient Networks.
Yeah, so it's interesting, and I use the word network purposely. So in the essence, we talk about how we work with patient communities. So the Global Patient Network is the team of individuals who are dedicating themselves to work directly with patients and patient communities to make sure their perspective comes into our decision making as a company. And so if you think about all of the incredible advancements that we're doing around science, science is great, and being able to meet unmet medical needs, but it's only as important truly to a patient and a patient's life. And so making sure that patient perspective is as valuable for us as a company, and understanding how the science help us advance is really important. So that's what my team does on a global level, working with patient and patient groups directly.
That's really interesting. That's got to be really fulfilling, because often we're thinking about the bottom line and our little departments and everything, and we got to keep a focus on the patient.
Yeah, absolutely we do.
Well, prior to doing this patient network role, and you were leading MSL teams, and I love the story about how you made that jump. I think a lot of people can learn from it. Can you share that story with our audience?
Yeah, so you highlight it. Like, I've been around for a long time, Michael, 30 years, right, in the industry, and primarily all of that within medical affairs. Because when I came into this space, right, I'm a pharmacist by background. When I came into this space, for me, it has always been about how do we, as a pharmaceutical industry, as a company, really help ensure that people make the very best decisions relating to their health. So in our early days, right, that was a lot around the healthcare professional, and how do we make sure healthcare professionals are fully informed. I worked a lot on how do we disclose information, how do we make sure we're meeting their needs, how do we make sure they have access to all of the most current decision that could inform a decision for a patient. And over time, 30 years go by down the road, I certainly have come to appreciate the voice of the patient and the patient perspective. And so shifting, a bit of my focus in my career to how do I help enable that? How do I help enable people, and people as patients or caregivers, make the very best decisions for themselves? And so I made a very purposeful decision in my career, probably, I guess it's been 3 or 4 years ago, that I really wanted to dedicate my time and energy in this space. And so I shifted from focusing on healthcare professionals in some regards to directly the interface with patients, and how do we amplify and raise the voices of patients. And so that's been my journey. And, I believe the future is about patient empowerment and people being in charge of their health.
Yeah, interesting. And it does make sense. We're targeting that message to the healthcare provider, and now it's more of a message right to the patients who are taking more control of their care and that sort of thing. And I can see that in a lot of different ways in pharma right now. Now the role that you're in, was that a newly created position? How did that come about?
Yeah, it's interesting. So as I was sharing with you, throughout my progress of my career, focusing on building capabilities. So I'm a builder. Like, I like building teams. I like building new capabilities, new ways for us to engage and connect. And for us as a company, it was about 8 years ago, I want to say now, I made a move in my career, right? I moved from Genentech, right, in California to Basel, Switzerland for a global medical affairs role. And at that time, 8 years ago, we started the patient partnership function as a new team and a new capability that we wanted to build out because we were beginning to see the future of where this was going from a patient perspective. And so we started that team, me and one other person, literally, on day one together. How do we want to go about doing this? And over time, like while I was focusing on international MSLs and other spaces, right, me and this other individual also started building out patient partnership and what that looks like. And over time, it's continued to build. The appreciation for that patient insights has grown within the company. And now, we have a fully dedicated function that is, really working with our scientists and our development teams much more closely. And so, for me to be able to shift from creating the team 8 years ago, helping to support its growth and development, thinking very strategically about how the company needs to become more patient inclusive, to today, where we're much more organized as a group and what we do, which has been great to be able to dedicate myself there.
That's cool. I mean, think about that. You go from across the country to start this new position, and it's just you and one other person, but now you have a lot of people in that group, right?
Yeah, we have a number of people dedicated across various disease areas. So we work in a chapter model, which I won't get into the details of this, but every company, right, working in a much more agile space. So we have individuals who are dedicated across disease areas with really deep relationships as primary relationship managers with the patient groups and communities that they're connected to. Really important, create safe places, build a lot of trust. And then we have a group of people that are working with me directly on those spaces that kind of cut across the various disease areas. And so we focus on policy related issues, like how do we ensure access to therapy, universal health care, digital health tools, privacy, considerations for patients in that regard, and making sure that we are bringing patient experience data as a part of our program. So now the team is pretty big, right? It's grown over time, which is really great.
And so you're back in California now, and you're leading the team that's overseas, international team.
Yeah.
And, the Pharmaverse is a leadership podcast. It's about leadership insights and stuff. So what insights could you share with someone that may have to lead an international team, or maybe that's doing that right now?
Yeah, my perspective and really, valuable learning, right? And I'm fortunate, right? Because I got the opportunity to go on an international assignment and live in Basel. And so I lived in Basel for 2.5 years with my family. And I really, as we grew the function and we started hiring people and hiring teams, I had that exposure and that experience to be with them, right? Be really with them and get to know them as people. And what I would say is, my appreciation working in an international environment is important to recognize the cultural similarities as well as cultural differences, because we all come from the space that we've come from, right? I'm a country girl from Indiana. I grew up very rural space, right? And I have now working with individuals who have a very different life experience from me. And so investing the time to really get to know and appreciate where people are coming from, that experience, how they make decisions, how teams interact, has been really, really important and a real learning for me, right? And that's an investment of people and time to be able to do that. And then I would say at the end of the day, once you've done that, you realize that we're all people and all people committed to a similar purpose, and being able to come together to focus on what needs to get done and being really clear, right? So the other learnings, be really clear in what is the outcome that we are all working together to achieve in a specific way, so that you can then set expectations. You can give people the space to want, to grow and develop. And you also are ensuring that you're measuring that progress and that there's some accountability for that. Across cultural lines and languages, the need for that clarity is even more important. You can't make an assumption that, oh, well, you know what I mean, right? Because you're a part of the U.S. environment or a U.S. team. It's very different on the international level. So that's been some of my appreciation. I also like it because it's much more a direct environment. Because when people don't have English as a first language, right, the words they use, we use with each other are just much more clear. There's no, it can seem like it's coming at you in an aggressive way. Actually, it's just people putting, the words on the table that they have available to them, which I actually like, because then there's no fluffery around that.
Makes sense. So it sounds like if you're going to lead an international team, it's really no different than, a team here. Be clear about your expectations, inspect what you're going to inspect what you expect, have measurements, KPIs or whatever it is. And if everybody's clear on those, whether their English is their second language or first language, it's either you're getting the job done or not.
Yeah, absolutely. And I think just the inclusivity piece. I mean, inclusion is a really important thing for me. Yeah. And so, helping people feel comfortable and in a space, right, where they can be themselves, no matter where they come from, is absolutely essential. And then it's just like you said, lead the team with clarity and set really clear expectations. And that diversity of perspective that people bring is really valuable, right? You'll get a lot out of international teams working together.
I've heard a lot about that, the diversity of thought, getting a team that is not a bunch of clones of each other, but bring a lot of different perspectives. And I got to think when you throw the international layer on top of that, you really can achieve that. You
really can, right? Because you will hear, perspectives. And to me, right, at any time you're now on as the decisions we take, right, as leaders, and you want to make sure that anytime you're making a decision, that you're doing that in a very thoughtful way. And I'm always cognizant of, am I making this decision through my lens or through the company lens and the perspectives that are around me? And so when you're working with a diverse team, you will hear thoughts and perspectives that really make you go, huh? Where's that person coming from? Or how did they think about it? And to me, it just helps make sure we don't have blind spots, right? That we have to be able to open and consider them. You can take a decision that you're going to take, but taking it with that appreciation, I think it helps you make better decisions as a leader.
Yeah, it's a wonderful insight, but it also sounds like you've created a culture where people can bring the idea. It's a safe place that they feel included in the whole space and comfortable to share those. This episode is brought to you by K. Bassman International, the leader in pharma and biotech recruiting. When pharma executives need to make critical hires, they go to the experts at K. Bassman, pharma's one-source staffing solution. Visit kbic.com. Now back to the episode. Thoughts? How do you achieve a culture like that with such a large team?
Yeah, as I said, inclusivity is really, really important to me. And I think it starts with who you are as a person, right, as a leader. If I want to create a safe place for others, and I genuinely do, I need to come into that space in a very genuine and authentic way. And I will tell you, years of leading and being with different teams and people, allowing yourself to be vulnerable is not easy. But as a leader, if you can't be vulnerable and share your mistakes and realize when you failed and laugh at yourself and be real, just genuine and authentic, and show some of the things that you worry about, what I'm trying to focus on, what I'm trying to develop, but what am I doing to try to get better? You have to be able to share that with your people around you, because when you do, then it's safe for them, right? And then they are willing to come in. And so really taking time to develop the relations, listen to people, listen to where they're coming from, and be your real authentic self, they will come into that space, and it enables that for them. So I heard this very early in my career. A team is always a reflection of and if I want my team to be able to learn and grow and, take the failures as learnings along the way, then I better be able to do that too, right?
Yeah, good point. And it makes me think of, I have this vivid memory of you. It had to be 10 years ago or something. We're at ASCO, and at that time you're with Genentech, and I'm a recruiter at ASCO trying to get business, and Genentech did not need a lot of help from recruiters to find talent. But still, you sat down with me, you gave me some of your time, and the only thing I remember of the whole visit was how undivided your attention was and how important you made me feel. And I got to think, that is such a great leadership quality. How has that, undivided attention to other people contributed to your success?
So I will say that I think it contributes a lot. I innately believe small things make a big difference, because I have appreciated throughout my life the small things that people have done, really, that have made a difference for me, helping me work through a situation, helping me have a real conversation. And the only way you can do that is to practice really active listening, right? Really active, not just listening, but actively listening, engaging, and taking that as an investment for the time I have with you or the time I have with something else. I believe, and every interaction that we have is a moment that matters, right? So make the best of it. And if you think you can multitask and, I'll check this, or I'll see, I got something, forget it. Absolutely forget it, right? What matters is in the moment when you're with someone to really be able to connect and engage. And while, it's true, maybe we didn't need a lot of business for them, but you know what? I got to know you as a person. I got to know your strengths, what you're really good at. And we've stayed in touch ever since that interaction, because I realized in that conversation, wow, Michael has a lot of experience working with different people. He knows a lot about different styles and what's good and good matches, right? And so I have developed a sense of trust and confidence with you that I wouldn't have done otherwise. And so I just think every moment that we have with other people matters. So make it worth it, right? Make it worth it on both sides.
Beautiful sentiments. Thank you. And well, I'm glad that we've kept in touch. And, one of the things that I really admire about you is your bravery, because, what not everybody knows is you were in Indianapolis, then you moved to California, then from California to Basel, and then back to California. Meanwhile, this is all with a family that has all the same, pressure points that all of our own families have. How has been your willingness to move locations helped you move up in your career?
You know what? I think it's helped, and it's helped in a couple of different ways. One, I think that getting different experiences just enriches your experience as a leader, right? And so if we stay in our places for too long and then we allow ourselves to get comfortable, we're not growing, right? If we're too comfortable, we are not growing. And so sometimes you have to be able to step out and take a leap and put yourself, moving your family, going to a different location, taking different roles, pushing yourself into new spaces, I think is so important. And yeah, I'm right with you. I mean, my daughter was in the second grade when we moved to California. And then, she was in the fifth grade when we moved to Basel. And so we're there for 2.5 years, right? And then, make a decision to come back to the U.S. It is a real family commitment. And everybody has their own, Lord knows, I am not, a parenting guru by any means. But I will say that we have always held true as a family to making those decisions together and listening to each other's perspective. Rather than just saying, okay, honey, to my daughter, now we're going to go here and now we're going to go there, right? She's always been and felt a part of those decisions, and whatever is important to her, to be able to understand and say, okay, if this is what's really important to you when we go here or we do this, then we need to hold ourselves committed and true as parents to that as well. And so, yeah, all of the dynamics of family work-life balance and all of those considerations have certainly been a part of it. But I think at the end of the day, from a career, what you asked about, allowing yourself to take the leap helps you be more courageous. And it's the courage you need to step into new places so that you can continue to grow. And I will say, once you take a leap, the next leap gets easier.
Yeah.
Right? It's the first leap that was the hardest for me, right? I can move to a different country in Switzerland where, we didn't speak the language in the community around us, but the hardest leap was moving from Indiana to California, because that was the first leap for us, right? And thinking about making that move from a very comfortable spot.
A lot of the candidates I talk to, they want to move up, but they can't move. And it's really, I see this in a lot of leaders. There's that one pivotal move that they make and their family's all bought in, and it really makes the difference to propel them to new levels in their career. But there's another thing that I'm dying to ask you, and this is a little self-serving of a question, but you've led MSL teams in the US, you've led MSL teams internationally, and you've always had a nose for sniffing out what is good in MSLs. What advice would you give to other MSL leaders that are hiring MSLs? What do you think makes a great MSL?
I will say, and I suspect that many of my leaders as colleagues have a similar opinion, there are the innate strengths and talent that people bring to the table that are so important to identify. And, my interest in getting to know candidates as people is what is it that they bring to the table innately, and their ability to engage with me, their ability to adapt their style in developing relationships with others, their ability to work through conflict, hard situations. That's what's at the core, because the heart of the MSL role, is about a relationship. And once you have the foundation of a relationship with somebody, now you can talk science. Now you can, help have conversations about different experiences and draw out what's really most important and meaningful for them. But it's all on a foundation of trust. And so, that is you go back to that moment that matters, right? Can a person create a moment that matters? Can they engage with me in a really thoughtful, meaningful way? And not just say the right words, or answer the questions, or, talk about, certainly, I'm not saying, the competencies of scientific experiences and technical skills, all very important as baseline, right, for the types of conversations that they're going to be engaging in. But most important is just the innate talents and strengths they bring to the table, and what's the mix look like, right, across the group. So trying to keep that much more focused on competencies and transferable skills than the checkbox of here's the experiences that I've had, right? So we can be fair to people and what they bring to a role.
Yeah. And it's so interesting that you bring that up, because when I'm recruiting for positions, it does feel like we have to check all these certain things. And if they don't have them, we never get a conversation to really understand the EQ and the it factor and the connection the person can make. And is there anything in the interview process that you particularly do to really find out if they have that EQ it factor?
I really invest some time in the conversation around, what they've learned from. So I do ask. I ask about, where have they failed? What have they learned? I ask about, tell me a conversation you've had with a difficult person and how you thought it went sideways. What does that look like? I ask what they're most proud of. I will always ask, my last question, typically if you're going to interview with me, is what are you most proud of? Because I'm interested in hearing how they reflect on their lives and what gives them the most joy as a person. And so those are typically the questions, beyond the tell me what you've done and your accomplishments. I want to go deeper. I really want to understand, how are you going to interact with people? And how have you stepped into spaces? This is another. Have you stepped into spaces that were new to you, that you didn't know, that you had to learn, right? How was that journey for you? Not just what did you learn, but how was the journey of learning, right?
Interesting. And I know another topic that's one of passion for you is women in leadership. And what advice would you give to other female leaders that are listening?
You see the smile on my face. So this is something I am incredibly passionate about. And I will say, if you ask, what's my passion? What gives me joy? My passion is lifting people up. And I mean that sincerely. I like lifting people up. And for me, women as leaders, my ability or time and energy that I give is very much in what can I do to help lift women up so that they can be their very best. And why I choose to focus on women is because my own experience first, right? It's always a personal experience and connection where I had to learn along my journey. I talked about this before, right? How do I be a really genuine, true, authentic person? And, throughout our career, my experience as a female, I got a lot of feedback. You need to look like this. You need to do this. You need to think in this way. Hold your emotions. You hold them on a sleeve. Have a face that doesn't, project or show so much emotion with other people. And, I took all of that advice. It wasn't like I just left it by the side. But at some point, you got to realize, like, if I am going to be the best I can be, I have got to allow myself to be genuine and to be vulnerable and to come into a space and know what I'm good at and not let the voice inside of my head, right? Because I didn't need all, some of the feedback you get. I got a lot of stuff going on inside my head, right, of myself. So your own self-limiting beliefs, yes, right, that are playing out. And so that's my passion and energy. How do I help people see the very best of themselves so they can step into these spaces and lead and not hold themselves back? Because that's what I did. And I will say, we talk about the glass ceiling with women. We reached a glass ceiling. What I came to appreciate through a very purposeful, like my own reflection of leadership. I was so worried, like, am I niched in my job? Is this it? Am I at the top of my career? Is this, what I found out is I didn't have a glass ceiling. I had a glass wall, right, that I put in front of my face to protect me. Because, again, you get all this feedback. You think you need to act and behave. And the natural response to that is to, want to protect yourself a little bit, which causes you to be boxed in. So the other perspective I would say is just, think about the glass. Where's your glass, right? If there's glass around you, are you doing it? Or are you really limited by opportunities?
Yeah, I love that, because it's true really in any gender. It's like we hold ourselves back. We're our own worst enemy at times.
Yes.
And
women and men, whatever that is. But how do you overcome that?
A lot of it is that first step, like you talked about. That first step gets you going. And it's that first step that's the scariest, into the unknown. I've learned a lot from these sentiments. And there's another question that I think a lot of our listeners will benefit from. Because one way to move up is to make a bunch of job changes. Move here, take this job, move there, take this job. But even though you made some really pivotal moves in your career, you also have some amazingly long tenures at big companies where you moved up within the company. Is there any specific advice that you would give to someone that doesn't really want to change companies but wants to navigate up within the company they're in?
Yeah. Here's my advice. Take it for what it is. I'm a passion-driven person, right? I follow my passion, and I lean into that passion into new spaces. And for me, the question for consideration has always been, what do I want to be, not what do I want to do, right? Because what you want to do will come along the way if you're really clear about what you want to be and what do you want to be known for, and what's the spaces that you're willing to take risk and be more courageous and step into because you want to make a difference. You want to make a difference in a space that you're really passionate about. And so for me, incredibly, incredibly fortunate in my career that as I have grown and developed and been given these spaces where I'm empowered as a person, I've been able to lean into those spaces and say, okay, and now what's the next thing? We've done this, we've created that, we've built that capability, whatever. Now what's the next? What's the next step? And I think that's looking towards the longer term outcome for yourself as a person. And then, career will happen as long as you're guiding yourself in that direction and being thoughtful about that. I hope, right, everybody's aspirations can come true in that way.
Yeah, I can tell you're very passionate about all this stuff, and that's why I wanted to have you as a guest. But also, you sit on a board for the Patient Focused Medicines Development Organization. It's a passion area for you. Tell us about that initiative and how someone else could get involved if they'd like to.
Yeah, so you can't really see my pen because it's just a little pin. But okay. My pen is actually my PFMD pen because I do strongly believe in the power of this organization, Patient Focused Medicines Development, PFMD. It is all about bringing the patient perspective into our decisions, and it brings industry, patient groups, tech, all collaborators, devices into this space together where we can really talk about how do you want to drive meaningful change. Because I think, what's important for all of us, certainly me, that I have appreciated is as much as I want to accomplish and do, there's only so much I can do within my company. And if my longer term outcome, if my goal is truly to amplify and support the patient and lift them up, I have to be able to do that in collaboration with others, because that's really what it's going to take to move the needle. And so PFMD works in a very open mindset where all voices are heard and we can come together and really talk about how we want to make a difference. And, it's a member-based organization, and there's lots of opportunities. I mean, if you even just want to contribute on a work stream or contribute on developing a tool. Right now I'm focusing on a work stream around patient experience and patient experience data. Like, how do you get the patient perspective to make sure you're designing and developing the right data as a part of our evidence generation plans? It's open. I mean, you want to come and you want to get involved, just reach out to the organization, express your interest, and they'll find a place for you to contribute and have a voice. And the opportunity then to learn and see what other people are doing, it's absolutely incredible.
Wow. What is the website?
I think it's pfmd.org. Yeah.
pfmd.org. Got it. Okay. Makes sense.
Yeah.
Well, sadly, we have come to our time limit on this, which has gone so fast. It's been so nice to catch up with you. And I'm sure a lot of people are going to gain a lot from this conversation. And all in the Pharmaverse, thank you for your time and your insights. I know I've benefited from them. I'm sure they have as well.
Thank you. Thank you so much for this time. And I really appreciate it, Michael.
Oh, my pleasure. Rebecca's a great follow on LinkedIn. Also, feel free to connect with me as well. But that does wrap up another episode of the Pharmaverse. We have many more great leaders lined up for you, so there's still a lot to come. Thanks for listening, and see you next time in the